Hello, veterinary friends. Welcome to the Veterinary Life Coach Podcast. Today, I have a wonderful return guest for you. Her name is Dr. Maggie Yu. I know we're both so excited because she has great energy. Maggie is a highly respected family practice physician and a certified functional medicine physician. And over the past 16 years, she's been providing, or more than 16 years, she's been providing education. 27. Uh-oh, we got to update your bio.
I know, right?
Well, she provides education and training on topics related to longevity and reversing chronic diseases through various media platforms. She is also the author of the best-selling book, 8 Out-of-the-Box Ways to Transform Your Health. Welcome to the podcast, Maggie. I'm so excited to have you again. She is a proud dog owner as well, which I got to meet her dogs a little bit on the last podcast. And I'm really happy to have her back.
They might make an appearance.
They probably will. Yeah, mine are in here too, but they're kind of sacked out, so they'll probably be quiet. So today we talked a little bit before we got on this podcast about what we were going to talk about, and we landed on allergies in people. Yeah. And why people are getting so much more allergic these days, why everyone seems to have gut issues, even sinus and things issues, I think sometimes will stem from the food and the way we eat. So that's what we want to talk about today.
Yeah, I stumbled upon like the whole thing around food allergies almost accidentally in many ways, not realizing that as a physician, some of the biggest mysterious illnesses that I was struggling in with myself, with my clients, and with my own children, in the end turned out to be food reaction related. So it's been a long about come back to full circle moment where it does come back to reactions to food. But the question is, I think people aren't asking the right questions. So this is I love taking this topic and digging a mile deep with this with you and your audience. Yes. And I would love, because I want everybody out there who's listening, and if you're whatever platform you're listening, if there's a comment section there, I want you to share in the comments with me, because I love reading these comments as to what do you think, food is connected to certain types of symptoms in you or your family members. But what has been the questions you asked your physicians? What has been the response? Do you feel like you're hitting a brick wall? If you do know food is related, what do you think what symptom or disease do you think it's related to? Because I want to take a look at those. I already, I've been asked those questions thousands of times. I'm going to attempt to answer every single one of them here today. And then I'm going to go back and I'm going to read those comments. And I would love to be able to answer more of these questions because I do love reading comments afterwards. But this is this is a giant Pandora's box.
Yes. Well, yeah. And I think you just mentioned about what did the doctors say when you go in there asking about allergies. And I've been in that situation, and the actual GI specialists or the doctors, they're just like, there's nothing wrong with you.
Yeah.
And I've been in that experience. And then I've gone to a PA who was like, well, let's try a food trial. Let's see what the problem is.
Yeah.
Yeah. So I love that a lot of it's related.
And we're talking about, and I would love to talk about using my own dog as an example, right? As a pet owner, example would be, I have a doodle and he gets recurrent ear infections. And we've talked about that before. And what do we do when we bring him to a veterinarian is recurrent antibiotics, right? And maybe, and possibly, and it doesn't just go with ear infections. It comes with animals with doodles may have recurrent ear infections, but notice also doodles like to vomit and have diarrhea. And we just say, oh, that breed, has sensitive stomachs, right? But there's actually it's so interesting as I dove more and more over the years into did you know that the number one reason why dogs have recurrent ear infections, certainly is, and some certain breeds are anatomical, right? But let's move beyond the anatomical.
Right, but that's not the only reason.
That is not the main reason, because you could have 4 dogs with the same anatomy, and one of those dogs is going to have a ton of recurrent infections and another doesn't. And why? They have the same anatomy. And the answer is food allergies, food reactions. It really is. And I can say that for humans, the analogy here, let's come back to humans, is how many of you out there have chronic pain, neuropathy, How many have dizziness, vertigo, POTS, postural orthostatic tachycardia syndrome, dysautonomia, ADD, ADHD? How many people have eczema, asthma, heartburn? How many people have weight problems, insomnia, right? Like every single one of these problems, I can tell you, has as one of the major kerosene under the fire is food allergies. Okay. And I'm going to tie two pieces together: food allergies and escalating digestive problems. They are on the rise together and they are feeding each other. Okay. Right. They're ping ponging back and forth with each other. And we're going to make that connection today.
Yeah. Is it our food? Is it the way our food is manufactured and made in the United States? I mean, I noticed when I traveled to Italy, there was a difference, right? The gluten didn't bother me as much. Yes. There was definitely, it was easier to eat over there than it is. Is that part of the problem?
That's great. That's a wonderful question, right? It has our food changed so that maybe a common allergen is increasing in the amount or potency in our food? And the answer to that question is super smart. Yes, that's one of the reasons, right? So the gluten content of the bread in the United States we have today compared to 60 years ago is 11 times higher in gluten.
Wow.
And we have selected for wheat that has higher gluten content because it increases the elasticity and shelf stableness of that product to be shipped massively, not just in the US, but around the world.
Right.
So the grain that we have here has 10 to 11 times more gluten. And gluten is one of the most potent triggers of autoimmune disease. It's one of the most common foods that people with autoimmune disease react to. And it's your body, when it sees gluten, if you're one of those individuals that sensitive to it, reacts probably 10 to 20 times higher to gluten than it does, let's say, to lettuce, if you're allergic to both. All allergies and reactions are not created equal. This is why peanut allergy kills how many children and adults every year? And you never hear that about lettuce allergy. You can be allergic to both, but the reaction to peanut is literally 100 times more than anybody's reaction to lettuce would be. It's because of the irritability of the way that allergen looks. Now, taking gluten as an example, because wheat is subsidized, wheat is cheap, it's a great filler, right? And in Asia countries, it used to be rice. Now it's becoming wheat over there. That's why you're seeing rise of autoimmune disease in Asia. Diabetes is an autoimmune disease. Why do you think Japan and China is going through a diabetes crisis? It's because the rice-based diet now has been replaced by a wheat-based diet, right? And the wheat is being selected for to have 10 to 11 times higher the gluten content, which, is for shelf stability, sellability, and all that, right? So we are exposed to certain types of allergens at a much higher rate. And even when you look at something like peanut allergy, right? In some of the dietary changes with people saying, I want to go low carb, there's a lot of people going keto, or carnivore. These keto diets and carnivore diets also will massively, by choice, people will start to eat massively and a protein in an amount that they wouldn't have in a normal balanced diet that's healthy. So we're also actively choosing on certain types of elimination diets. Unwittingly, we're thinking it's healthy, exposing ourselves to massive types of nut allergies, for example. We get way more nut exposure than we used to because people think high protein, healthy, high fiber, high fat. Right? Yeah. That's not bad in itself. But at the same time, if you didn't know that peanut or cashew is a problem for you and you say, I'm going keto to be healthy, or I don't want to feed my kids carbs, what are you going to do? Feed them some granola bar that has more nuts in it. And I'm not saying that nuts is a problem for your child, but if it is, unwittingly being healthy, you're exposing them to a higher level of some of these allergens at an alarming rate. And what we find with allergies and food sensitivities is the more you expose to them, especially as super allergens where it's super reactive, the bigger the reaction is over time. And this is why, you may start out with a kid with, let's say, cashew nut allergy. And for the first 10 years of his or her life, it's like nothing. And then maybe at 12 to 13, you'll notice eczema and you're like, oh, none of it. And then suddenly at 17, accidentally gets exposed to cashew once. And suddenly it's an asthma attack that lands in the emergency room. We are getting a very high exposure to these super allergens. And what makes them super allergens and super dangerous is that they escalate in their reaction, and it's unpredictable how quickly they escalate. It's not even a straight line. You go through and then suddenly there's a logarithmic rise in reaction, and boom, it turns on an autoimmune disease. Boom, it turns on asthma and you're in the ER. So there is increased exposures is definitely one of the problems.
Yeah. And not only that, but there's so many foods that we eat. I would imagine narrowing down the one that's the problem is difficult.
You cannot figure out what food reactions you have by an elimination diet. I'm
Yeah,
just
I
letting you
did
know.
that. That elimination diet sucks too.
I am the opposite. This is why for
I
me, eight out
did
of the
it
box
once and
ways.
it
When you
was
look at the
terrible.
book, I am the opposite of what you are going to hear from a naturopath or a functional medicine doctor.
Right.
And I am well versed, well trained in all of these disciplines and the research and the experience, clinical wisdom around this. Elimination, you cannot figure out what foods you are allergic to or sensitive to by via an elimination diet. And the reason is this. Okay, write this down, everybody.
Okay, I'm writing. I got my
Okay.
pen.
Even in this doodle, okay, even in an adult where you're like thinking here, like all my reactions are related to food allergies and food sensitivities, because that's what Dr. Maggie's talking about right now. Boom.
Right.
Well, that's not true. 50% is, but 50% of your food reactions is related to poor digestion. This is why, for
Yes.
me, I would love my next book to be why digestion is the hidden holy grail. And it's
Yeah.
having its moment. Digestion needs to have its moment
Right.
in our wellness popular culture right now.
Well, and we're kind of starting to figure that out, I think. I mean, there's a lot more talk now about probiotics and prebiotics and all the things.
Mm-hmm.
So I think we're starting to figure it out, but I think we're just scratching the surface.
Yeah, we're starting the retail selling of products for it. That doesn't mean that we've started to figure it out.
That's true. Yeah, people are
Okay.
making money off of it, right?
Sure. Like we are trying to take a concept of digestion, which I will talk about why it's important for you and what's in it for you to understand this digestion piece.
Right.
But what we do is the moment we say, oh, that might be the problem, instead of actually trying to raise the collective consciousness through education and wisdom rings that we can gain around this topic, and that way we can really solve this problem, retail has made it, what can we sell to green band-aid this problem? We're in the decade of green band-aiding digestion, not actually solving it. Okay. And now what's in it for you? Why do you even want to hear about digestion, and why is it linked? Okay, think about this, everybody. When we're born, we have like 10 steps in digestion, let's say minimum. Okay, I'm just simplifying it. And when we're born, certain steps are already weak or broken genetically. How do I know this? Think about yourself, think about your children, think about your puppies, right? Dogs. Is that how many of us have had colic, have had formula spit up, formula intolerability, picky eaters? How many of us have had diarrhea and constipation, gas and bloating? How many of us are just nauseated every time we wake up in the morning? How many of us have missed school because we've had, kids have said, my tummy aches, or I have a headache, or I'm too tired? How many kids have dark rings under their eyes? And how many kids develop eczema, asthma, ADD, ADHD? How many breeds of dogs have anxiety, even as puppies, right? And we just say it's a breed problem. Well, let me tell you something. There's a genetically, all of us are born, and some of us more than others, with certain steps out of those 10 steps weak. Okay. Now, I hope everybody in the audience, you may want to replay that list I just did, or you might just want to get my book. The first medical chapter is called Digestion, the First Domino. And what I want to do is promise everyone in this audience, since you've already made it through here, is I'm going to give you a free download copy of my book. 8 out of the box ways to transform your health. So in the show notes, you can go and click the link and get a copy. Okay. But there's a reason the first medical chapter is called Why Digestion is the First Domino. Digestion is there to break down foods from big to little pieces. When food is really little, they're really easy to absorb, right? Right. And they're really low allergen, because we've broken down those allergens from really big allergenic, big, bad, ugly to tiny little absorbable. So you're actually lowering the allergy load when you have good digestion. We're born now with certain steps of digestion broken. So is it no wonder that as this kid goes along, if the digestion step is broken, over time, more and more exposure to these big pieces of undigested food, this kid becomes an adult human that has more and more food allergies because our digestion sucked in the first place. Right. And then here's the problem. As we go on in life, we actually break digestion more because you bring the kid. We actually do this in the NICU and ICU, where we have a kid who's regurging formula, and we actually give IV to the NICU regurg preemies and to babies like Zantac, Tagamet IV, and we give our animals that as well, to quote unquote shut down stomach acid because they're refluxing. But they're not refluxing because they have low stomach acid, but we give them this medication. Let's just shut down the stomach acid, because it temporarily may not burn or something, but at the same time, it's other problems. But we give them medications like Prilosec, Zantac, Tagamet. And what happens is we actually use medication to iatrogenically completely break a step in digestion, not just weak. We take a weak step and we break it in an attempt to help problems we haven't even diagnosed or understood. And we do this. And I remember as a family physician, we would put people on Zantac for 10 years. We'd put people on the purple pill for 10 years. And what's all the literature coming out now about these medications? Long-term use of these medication causes huge medical consequences. Right? With what we call atrophic gastritis, increased risk of cancer, all these mineral deficiencies, digestion, absorption problems, infections in the gut. Because what happens is when you take these medication and you shut off the stomach acid is there to be too good. It's there to break down pieces of food. It's there to sterilize and clean the environment. So then why are we sitting here talking about, why does all our animals have yeast in their ears and fungus? Why does adults have H. pylori now? Why do we have SIBO? Why is there still rising candida? Because you just shut off digestion even more. Our own defense against infection, each step out of those 10 are being systematically, they're either born weak and then we have medications that shut it down. And thirdly, we get infections, I call super infections, that will permanently or sometimes temporary or permanently disrupt steps in digestion. Let's use COVID as an example, the big C. I'm going to refer to it as the big C right now. With the big C, what happens is many individuals, and we've noticed ourselves when we get it, now there's a lot of GI symptoms, gut symptoms, with nausea, stomach pain. And it's not just to when you have the big C, it's long haul. How many people, that was like the start of them saying, oh my gosh, why am I having heartburn now after this? I never had it this bad. Or I'm getting diarrhea, or like my heartburn, my nausea. Or some people was like, I never had H. pylori for ulcers before, but now after the big C, I suddenly have been diagnosed with this infection and that infection. And the reason is certain super infections like COVID, like Lyme, like Candida can come in and they want to infect gut cells. So they literally infect the very cells that are responsible for digestion, and they can break those steps down temporarily or permanently, depending on the severity of that infection. So what you're seeing is assaults on digestion leveling up. And so as more and more steps in digestion breaks, more and more food doesn't get digested and stay as big undigested molecules, you see food allergens on the rise more and more. So we are in an epidemic now. We're seeing the end result of an ongoing systematic 20, 30 year of iatrogenic medication-related assault on shutting down digestion like this. And we, along with predisposition and genetics, and then now we're following it with now we're on a new era where we're understanding systematically shutting down digestion has systematically increased food allergies. And now we hear things like mast cell activation syndrome, histamine intolerance. We have autoimmune diseases. We have mold, all this why is this so crazy on the rise right now? It's not an accident. It's because we, as a health industry, have systematically killed off digestion. And then we wonder why food allergy reactions are on the rise.
Yeah. So if somebody's on those kind of medications like omeprazole or Pepcid, or, if a doctor's put them on those medications, I know you probably can't tell them what to do.
I can.
Until you're their doctor, maybe.
I can, and I will tell you what to do.
Okay, tell us what to do then. If somebody's on those medications and they know that whatever problem they're being treated for isn't really responding well, we're not
treating the real problem. They're getting a Band-Aid, a prescription Band-Aid to treat a symptom. But the Band-Aid itself is making the real problem worse.
Yeah.
It's not fixing digestion, it's shutting off a step.
Right.
Actually.
Taking away something that you need.
Critically.
Yeah.
And I have Beverly. She's a great example. I've been working with Beverly for a couple months right now. She's had this, what we call, she called it a diaphragmatic pain, a pain in her diaphragm for 10 years. And she's also had severe asthma to the point where at night she's like gasping for air so much that she's like on oxygen at night, and she's waking up and she's oxygen saturation like 70-80% at night, right? And she has been told all these years that she has heartburn, and she's been taking Prilosec, right? And so, it's interesting for me was that, in addressing this, what she realized, she took herself off it like maybe a year ago, and her asthma has gotten a lot worse because she hasn't addressed digestion issues yet, right?
Right. She just stopped the one medication.
So interestingly, I've been working with her, and this is what I'm going to tell you guys is the holy grail is start working on your digestion, right? And what that means is understand what those first 10 steps are. It's in that first medical chapter of my book, okay? And one of the first things that if you do nothing else, you don't want to understand the 10 steps, I have one product called Digest It. And it is our best-selling product. And the reason it's our best-selling product is it covers all 10 steps of digestion in one product with minimal number of ingredients, right? So I tell people, if you don't do anything else, humor me and just do this as a trial, which is pick up Digest It from the store, and you just do, and we'll give you a link to our GI collection where Digest It is, and do this as a test for yourself, where you take 1 Digest It with a small meal and 2 Digest It with a big meal, and you do it every single day. Okay. 90% of individuals, when they take something that covers every single step, will notice some difference. Okay. Positive. Okay. Right. And what that tells you as a test is that, oh, there's certain steps in my digestion that's broken. It hasn't been supported. And when I support it, there's a positive change. Like, that's just a test, right? I'm not saying you even have to take it for the rest of your life, but like, if you first step is, yes, read the book at that chapter, but at the last page of the chapter is what I call action steps. And the first action step, if you don't want to read the chapter, go to the first action step, and it'll be like, take Digest It and do the test.
I'm sure they'll read the chapter.
Right. But I know how I am as well. And I wrote the book for me, which is like, I'm all action. Give me to the action step is order Digest It, 1 with small meals, 2 with big meals, and take them every single day for a couple days, and maybe even be a week or 2. And you're going to be 90% of you will be shocked at what changes. And then you're going to start it's going to start clicking, where you're going to be like, oh, Beverly just told me yesterday, my chronic constipation is gone. Okay. I've had 20 years, chronic constipation is gone. I didn't expect that. I didn't even know it's related. I'm like, it is. And she had recently been in the emergency room, and her doctor said, get back on your Prilosec. And I said, you know what? You were in the emergency room for that shortness of breath. Do it as a test and see what happens. She took it for 3 days, and her asthma got way worse, and her diaphragmatic pain got way worse. She stopped it, and now is coming down and getting better.
Yeah.
Yeah.
So no change in diet.
No, she hasn't made any other change in diet even. Right. Okay. This is purely like talking and walking through digestion.
Right.
Right. So, and interestingly, because Beverly has digestive problems for so long, she couldn't handle 99% of products for digestion. She couldn't handle because she's allergic to everything.
Right.
Right. So for Beverly's case, in working with her, instead of like, Digest It is great in terms of it covers all 10 steps with minimal number of ingredients, which is why it's a really good product. Is
it natural things? Like, is it herbs or like what's in it?
Herbs,
if you can
and
tell,
ox bile,
like even
all
general.
natural.
Yeah.
Because these are the things that we naturally do to actually, like, we naturally make stomach acid, right? So there's natural stomach acid, right? That and plants make like natural stomach acid, like bromelain, right? So plants in the plant world make it. Animals in the animal world, we make our own ox bile, right? So it's really important to look at what does the natural world supply us that naturally works to optimize digestion, not shut off steps. Medications, they're just to shut off steps. This is what can we actually take, right? So, and everyone's different. But that being said, what I'm going to say is the general rule of thumb is, if you take a product, and I'm going to warn you, don't go out and buy some multiphasic digestive product, because one of the reasons is it has at least 30 ingredients.
Right.
if you're going to find, and that was one of my challenges when I first started diving into digestion was, I was like, oh, I'm just going to tell my patients to get on some over the counter, good company, digestive product that covers most of these steps. And it was at least 30 ingredients, and at least 30% of individuals highly allergic couldn't tolerate and react to them.
Some of the ingredients, yeah.
So then I had to say, how can I simplify that to minimum number of ingredients that covers these steps? And that's what digested is. So then, 95, 99% of individuals can take this product and tolerate it, and yet it supports all 10 steps. That's why this product, I had to come up and formulate something like this, because it like all these products out there are just too many ingredients for highly allergenic and highly reactive individuals that we have now.
Yeah.
Right. So if you, nothing else, I can tell you right now, if you're on Prilosec, if you're on Tagamax Zantac, the first thing that you do is don't stop those things, because you'll regret it. If you stop those things and not learn about the underlying processes and learn to support that underlying healthy digestion first, if you just stop the medication, you're going to get crazy ass rebound, and you're going to be upset, and you're not going to feel better.
Yeah.
So that is not the way to deal with that problem. The way to deal with that problem is you need to learn, and you need to deal with you need to gain some wisdom, wings around digestion. And just read that chapter, right? Yes. Why digestion is the first domino. And the first test that you're going to do is pick up Digested, 1 with small meals, 2 with big meals. That's going to be your very first entry point into understanding what the steps are, seeing like immediately, like what are some of the positive changes that I notice when digestion steps are being covered. That's going to be a major eye opener for you, because 50% of your health symptoms and 50% of your food related reaction is not about directly just food allergy and removing those. It's about addressing digestion first. There's an order to what I call order of operations.
Right.
You can do the right thing at the wrong time. It's still the wrong time.
Mm-hmm.
So I have so many people putting all their eggs in basket. It's all about food allergies, doing all these crazy ass elimination diet, thousands of dollars on testing. And by the way, the testing sucks. And not getting outcome. Meanwhile, this big Goomba right here is digestion. If you don't deal with this problem from both sides of this, which is the digestion side first, and then the food allergy side of this, you'll never solve this problem. So do this first. Right. And then we're going to talk about food allergies and what you do about it. Well, Dr. Maggie, you just told me all the testing sucks, the elimination diet sucks. What are you supposed to really do? What's the real answer?
Right. What's the next step?
Okay. So I'm going to tell you that, even as veterinarians, and I know you guys send dogs sometimes to work with allergists, ENT,
and there are lots of dogs with allergies. It's very common.
I know, but it's, what, I'm part of all these holistic animal groups, and I've seen these results as well. So the kind of testing that we run on dogs and cats are the same, very similar technology to most of the tests we run on humans. What that means is that it is fraught with error, because we have what's called the antigen that they use for the testing isn't clean enough.
Right.
And the technology and so many people are trying to bring the price down also, and they're doing the mail order and all that. And so we have that technology for identifying. So there's between different branches of allergens. There's IgE allergy, which is what we call in the medical doctor world, the allergist, which is quick, fast, emergent anaphylactic type of reactions. That's a skin test or a blood test. We can tell what those are really easy. And we can do that in animals as well.
Right.
Okay. Those aren't what I'm talking about. Okay. Because those are easy. I don't deal with the easy stuff. Okay. That's breakfast. Give me some lunch or dinner. Right. But what happens is when you're dealing with chronic ear infections in cats and dogs, when you're dealing with autoimmune disease in dogs, let's say, when you're dealing with hypothyroidism in your dogs, when we're dealing with that in humans, right? All of these things have a food reaction component to it, right? But the problem is that IgE is the branch of the allergy that's responsible for anaphylactic, truly allergic, swollen tongue, swollen mouth, can't breathe. Okay, so let's put that baby to bed. That's easy.
Right.
Well, all these other disease states and chronic disease symptoms are food sensitivities, which is more like IgG, IgA, slow and low. They're allergy, but they're slow and they're low and they're hard to figure out. Now, I can tell you right now, IgA testing technology, forget about it. Like, it's awful. It's pretty much very useless, and I don't even use it. And problem is we have these big panels now, these companies sell that's IgA and IgG. And the IgA data from it's really not helpful. And then we have IgG testing, which I focus on. Okay. Now, out of, let's say, 100 companies that do IgG testing, of those, literally like 2 companies do a good job, like meaning that their antigen source is good, the results are consistent, reproducible, reliable. Now, out of these 2 companies, let's say, though, here's the problem. Animals and people that have prolonged digestive problems, they may have immune issues, chronic immune issues, and they may have autoimmune issues, are also notoriously bad at creating what we call false positive and negative in our results. This is why people say, why do I have elevated WBCs, white blood cell count all the time, or low white blood cell count all the time? Because you don't have a normal immune system. So we're talking about these high-risk individuals without a normal immune system, and then we run a really good test on them, and even the best test, and what we find is a lot of high false positives, false negatives. Well, is there a way with which you can actually take the noise away and see what the real data is? And yes, that's what I do. So in the last 27 years, what I've done is figure out of the hundreds of testing, what is good tests? We do good tests. Number one, we have a food mapping. Program where I and my team and I work with individuals. We do the right test. Number two, even with the right test, with the right data, we show 100% using your data, what is a true positive, what's a true negative. And I do not see this exist out there. And it horrifies me also looking at animal results. And I see, because these people post their results and tell me what their vet has told them. And they said, my dog is allergic to every single thing. And everyone in the group's like, poor baby, poor. It's not real. It's not real, right? Either it's a bad test or it's a right test with bad doctor training. And now we have a dog doomed to eating nothing. Okay? It's not work. It doesn't work. So what's in it for you, for me, is number one, we do right testing. I've sorted through the noise. Number two, we educate you exactly what is your true positive, what's your true negative, actionable. And most people will think coming in, I'm going to have to eliminate more. No, 90% of individuals are eliminating less and adding back more with data.
So you're saying that if they've already been tested, they already think they have an allergy to peanuts or gluten or whatever it is, and they've already had these other tests done, that your test is going to narrow it down so they have a better idea of what they're really allergic to.
They have
once they get their digestion figured out. They
have 100% like accuracy in knowing with certainty what it is. And here's the thing too, is that if an individual already know I'm celiac, I'm allergic to gluten, or I react to gluten, we don't have to question that anymore.
Right.
It's more, how do we move beyond that? Because I've eliminated gluten, I'm celiac, and I still feel like shit. I have vertigo, I have POTS, my hormones suck, I can't sleep.
Yeah.
Well, what else is it? That's the clarity that I'm here to give with a fine tooth comb.
Yeah.
And the thing is that if that's all you focused on, you're not going to get better. Because let's say you find out it is gluten, broccoli, and sesame. Okay, let's say you find out it's broccoli and sesame. You're like, oh, I eliminated those and I'm still not better. Well, why do you think that's the case? Remember both ends of the problem? Because on this side of it, you're like, but every time I eat like every time I eat, now I can't do broccoli. I'm doing all this cauliflower because it's good for my hormones. I'm like, I get stomach upset and I get diarrhea.
Yeah.
Well, you have a galactose digestion problem, like what we call galactose intolerance. And you might need to know that, oh, when I eat more cruciferous vegetables, I start getting more gas. Now I understand that's a digestive enzyme deficiency. I just take a Beano with it and I'm good. And now you're like, oh, I've eliminated just broccoli and sesame and I'm eating way more cauliflower, but because I'm addressing digestion, I have no symptoms and I'm getting better and better and better.
Right.
How do you tease apart what is a digestion reaction versus an allergy reaction? Well, doing food mapping with us. Right. Because you have to be able to be literally the master of both and attach and really work with people to look at both sides of this. And that way, that's how people get better fast.
Yeah.
Mm-hmm.
So tell me how the food mapping works.
Mm-hmm. Yeah. So people example.
Don't understand. Yeah. Tell me how you do that.
Yeah. When people work with us for food mapping, let's say, Julie, you sign up yourself for food mapping with us. We send out a test kit. It's a finger stick blood test that you do. And you send in the test kit. you start to learn because there's learning involved, right? You don't want to be dependent on what the doctor tells you when half of them tell you based on ignorance, not malice, ignorance, right? So there's learning. We have learning modules on an online university platform that you watch. There's self-paced learning involved. And then a couple of weeks after you turn in the blood test, you're going to get your panel results, big panel results.
And is this a IgG panel then that you're talking about?
It is an IgG panel that we're doing, okay, but it's the right panel.
Right, exactly.
And not all IgG panels are created equal.
Right.
It's horrifying. So it's the right panel. And once you get the results, you pick a week. I call that an immersion week, when you're going to be working live with us in small group, spending hours with the medical team and with the nutrition team. And we're going to tease this apart with you together. So you know exactly, looking at your data, not overwhelmed. Oh my God, poor baby, allergic to everything. None of that crap. Okay. Right. You're going to be like 100% when you're working with the medical team, when you're working with the nutrition team, you're going to know, wow, this is exactly based on this result, based on my learning and based on working really closely with this team. I know exactly what to move, what to add back in and in what order. Right. And we're going to be also troubleshooting during that immersion week, digestion. And digestion is one of those things that's really critical. Like in a small group, like Julie, let's say you come in, I'm part of the medical team. I'd be like, okay, everybody, let's go through Julie's digestion. Because when we look at digestion, we got to think about, what is Julie's past medical history? What's her family history? What's her medication history around digestive assaults? And is there an infection history? Was she recently big C'd? And did that make some of these symptoms worse? Right? What supplements have she tried or not tried? Right? And then now let's look at her food allergy data, IgG data, because the data is also going to help us. And then based on that, we're going to be able to tell, oh my God, Julie, you have a galactose intolerance, just like you could have a lactose intolerance, which is a deficiency of lactase enzyme to digest milk protein, not an allergy, digestion problem. You could have a galactose problem where you can't digest beans, certain carbohydrates, bell peppers, right? Cruciferous vegetables. Like there's all these different types of digestive disorders that are really easy to identify when someone actually takes the time to ask the right questions and walk you through that process together. It's going to be like obvious. Okay, Julie, yeah, you already eliminated gluten. It's the broccoli and it's the sesame. And guess what? You're really right. You do have a problem eating cauliflower, but it's not because you're allergic to it. It's because you have a galactose deficiency problem. Just when you eat this group of cruciferous vegetables that have high galactose, right, take a Beano with it. Problem solved. That's how easy this can look. But practitioners out there don't understand digestion. They don't understand the assaults on digestion. They don't understand the medication that people have taken and its impact. And they don't know how to work with people on medication that are actively suppressing and killing digestion right now and what to do with it. So as an MD, I really value having that credentialing experience background and knowledge to be able to say, oh, you're on prednisone. Oh, you're on this medicine or that medicine. Oh, you're on these inhalers. I understand what is the current state of what's going on with digestion. I could say, hey, on that Prilosec, here's the runway. Here's what you're going to do. Don't stop it right now. You got to remove this food and that food first. Great. Start digest it. Just start digest it right now. Humor my ass. Right.
Let's give it a shot.
You got to support that digestion, and your body needs to have a normal digestion for at least a couple of weeks and feel great before you even think about going down on any of this medication or that medication. That's the kind of level of specificity and medical expertise people and animals really need to actually troubleshoot these things we call escalating food allergic reactions. Is that kind of data, that kind of training, and that kind of specific troubleshooting that's very detailed, strategic.
Right. Yeah. Last time you were on the podcast, you talked a little bit about how you like to deep dive into animal nutrition.
Love.
So is this something that the Digest It and the other testing modalities and things that you're doing, is this something that you're hoping to start using in pets?
I would love to. I'm not a veterinarian.
So you need a veterinarian on board, huh?
But it's really interesting though, with the concepts. This is why I'm on a veterinary podcast. And I love I would love to be on more and more veterinarian podcasts, because for me, it's like, I'm not going to be a veterinarian and I can't be.
Right.
At the same time, if I see this concept enough in the veterinary world, we're going to impact pets and animals just the same, right?
Of course.
And in a sense, maybe even bigger impact, because we have control. Caring pet owners have big influence and control over our animals, which is great. We don't always with our kids,
Right,
right?
right.
And people, right?
Absolutely.
So for me, like, I think that animal medicine really needs to, veterinary medicine really needs to take a look at can we like look at some of these symptoms in our puppies and in our animals, like as a digestive issue, right? So thinking about like as part of the routine veterinary care, we should be addressing what probiotic are we feeding our pets on a regular basis. Like they need a spore-based probiotic on a regular basis. It's really important. And spore-based probiotic are probiotics that are from the earth, from the ground, which animals typically outdoors get a ton of. So for me, we really need to look at, and in my store, there is my favorite spore-based probiotic for animals. I know I own a supplement company, but I also carry some products for animals. So Phytospore is a great probiotic, spore-based, that I've been feeding to my animals, pets, dogs and cats. And I would say, even if you don't make any dietary changes, but what you do is give Phytospore on a daily basis to your animals, you're going to see some benefit. Because, like, example, I could always, with my dog in the past, there's like, the yeasty odor you can smell.
Oh yeah.
Like,
we know
like,
that well.
you can
We've smelled a lot of yeast.
Right on the little paws or in the ears, like, right. When I feed my animals the Phytospore on a regular basis, they smelled less or gone, right? But that's not, again, that's not a green medicine, meaning like we still have, like for my dogs, I eliminated chicken. Chicken is a great example of how an oversaturation of a cheap protein on the market for pet food has created tons of health issues. Right. Chicken is the number one most common protein that dogs and cats are allergic to. It is the number one ingredient in pet food, pet treats. And so talk about that, because 60, 70 years ago, would your dogs and cats eat this much chicken? No. But the kibblization of food has made chicken also the cheapest protein, to be used. And so we have, one of the biggest assaults on veterinarian medicine right now is literally chicken allergy as a food. Right. And I haven't gotten into grains as fillers.
Right. Which there's a lot of those.
Right. So, really importantly is grain-free food for animals, not part of their ancestral diet. And number two, I would say if your animal has any sort of health issue, start thinking about food allergy. And I would say, and the problem is you send them to the allergist or animal allergist, dermatologist, and their testing is, I'm just going to tell you, it's okay. It's not great. And it's very provider dependent on their education around these false positives and negatives. And I'm horrified at the number of people being told that their pets can't eat anything, right? It's wrong. It's not right. It's poor test or poor provider. And so for me, like, this is a case where just eliminating chicken will probably solve 50% of these health issues. So, like, number one, give Phytospore, like, one a day, right? To, if your dog weighs anywhere from 20 pounds and higher, I would do one a day. If it's 20 pounds or lower, I would do half a cap, like one every other day. My cats will do like, half a capsule every other day. If you eliminate chicken from their diet, which I've done with my cats and my dogs. And then the other thing is digestion support. Like, and there's plenty of companies out there that make digestive bitters for dogs, and they come in tinctures. So you don't have to do a capsule, for example. I formulate supplements for humans, so I can't tell you to take one of my supplements and just say, give it to my animals, even if I do. Right. Exactly. But I can tell you there's plenty of actual natural health products out there. Digestive bitters in a tincture form is plants that your animals out there would naturally want to munch on. Okay. Like bitters, like dandelion root, like leaves and root, those kinds of things. You can take a digestive bitters and drop a couple drops, and you can look at the instruction in the bottle and just put in their food, which is the easiest for animals. So those are, like, to me, the three cornerstones of like basic dealing with animal digestive health and food allergy issues. So that's a 3-pronged approach right there. That's the animal model. With the human models, I do the same thing, which is really support their digestion by educating the humans themselves having them start a digestive product like Digested. And you yourself, as a veterinarian, can try to digest it yourself and see what happens, experience that.
See
right?
how it goes.
And I do testing and education and hands-on work with clients so they get complete clarity with that data, which is missing out there. So that's the full solution of what it takes to actually deal with food allergy and food reactions as a problem. Food reaction isn't all food allergy related. 50% is digestion related. So we need providers that are trained to really put that together for people.
Yeah. And it's so fascinating how we talk about our digestive problems as separate from our allergies in people.
Is this it?
You know, it's I know, but it's fascinating how that has become kind of the norm. It's like, well, I have just for example, people will say I have gastric reflux and I have, ragweed allergies. Well, there's something that's probably affecting both of those things.
Well, because when we look at environmental allergies and food reactions, there's certain types of cross reactions.
Right.
So someone who has a lot of, allergic rhinitis, allergies in the nose or sinus or eyes, someone who has a lot of postnasal drip, someone who has a lot of asthma or pollen allergy, right? That's already telling you that their immune system ain't normal.
Right. Something's
It's
wrong.
hyper reacting to things that another person is not. So if that's already happening, that's what I call a herald sign that that's happening in their gut to food. Yes. It's literally a mirror, right? And I'm like, don't ignore the mirror, right? It's literally giving you a window so you can peek in and say, oh my gosh, this person has a major food allergy problem, histamine problem. And we just ignore it. We just say, here's some Flonase, here's some antihistamines, you're good to go. And then like 10 years, 3 years later, this person develops ulcers and is in the hospital. This person develops, an autoimmune disease, rheumatoid arthritis, and we say it's not related. Well, it could have been prevented literally 20 years ago if someone took these environmental allergens as a herald sign of food allergies and digestive issues that we got to have deal with earlier. So I tell anybody here that if you're going to do food mapping, the program with us, you're actually taking one for the team. What I mean by that is whoever's the person does food mapping with us has what I call a 3-generational ripple effect. So you took one for the team, but man, it's going to impact your spouse. It's going to impact your brother, sister. It's going to impact your friends. The generation above you is a digestive and allergy and chronic disease shit show. And then the generation below you, I love that part. The generation below you is your kids, but also your animals, right? That impact, I love that one because how would you like to kill Godzilla while he's an egg?
That would be easier, right?
Way easier. So I tell anybody who does food mapping with us, I'm like, you are taking one for the team as the ripple effect, 3-generation minimum ripple effect. You're the warrior coming up and taking one for the team. Right. So it's huge. So we work with couples and families all the time as a result of that, because once you get better, like you can't help but have a ripple effect. Once the vets here get better themselves with this, how can it not impact their spouse and the children? And how can it not impact your practice?
Right.
Right?
Yeah. Definitely positively.
Huge.
Right. Yeah, it is huge. Well, I appreciate all this. This is a lot of information. So tell people where they can go to look at your food mapping, get your book, all of those things. And I'll put it in the show notes as well. And I think we did this in the last time we were on.
Yeah.
But I wanted you to come back because there's just so much information.
Well, and we're in the age where we have information to any answer to your question. You can put in AI, you can put on Google and get an answer. Right. Yes. We're not on a lack of information. What we lack is wisdom.
Yes.
Okay. Yeah. So I want you to know, like, everything here is wisdom, rings and wings that were gained. That I want to just really deep down to give you a quick drill and how you can gain that wisdom.
Yeah.
Speed matters, and order matters, speed matters just as much. And when you do things in the right order, speed goes up. So that's why I wanted to give you like the order of what to do here. So number one, I'm Dr. Maggie Yu. So you can always go to drmaggie.com. You can also look up my name on YouTube. We have right now
a lot of YouTube videos.
Oh my gosh, we have thousands. I have thousands of YouTube videos on every topic imaginable. So if you're a veterinarian, you're somebody listening to this podcast and you're like, wow, I have dermatomyositis, I have lichen sclerosis, I have chronic pain, I have IBS. Look up that symptom in my name. I promise you a bunch of videos are going to come
You'll
up,
have a video.
right? So
Yeah.
watch it, because I love that, to be able to share this wisdom, which is like almost intuitive counterculture from what our medical system actually does.
Right.
I would love to give that fresh perspective and wisdom on a better strategy in the right order, with a faster speed to get to those results. So YouTube is going to be great. Looking at my name, any topic of your choice. Share, like if you have patients, you have family members, yeah, and like share this podcast with
People that are
them.
struggling with digestive issues
Oh my
and
gosh, I have about
allergies and all
100
of it.
videos on digestion.
Right.
Right now, if you're interested in what I do with digestion and food mapping and food allergies, go to myfoodmapping.com. It's a play on my name, Maggie Yu, myfoodmapping.com. Myfoodmapping is one word.com. And you can learn, there's a whole training series in there about understanding digestion, food allergies, food sensitivity testing, why I say no to an elimination diet and why I say yes. What I say
The
yes to.
main reason to say no to an elimination diet is it's very hard. And I still think that it's almost impossible to figure out. Even in pets, we have the same problem with elimination diets in pets. It's almost impossible to figure out what dogs are allergic to.
Well, because like, let me give you the broccoli and sesame example. Just one more nugget, everybody. Okay.
Yeah.
One more nugget before we close is, imagine, let's say it's gluten, broccoli, and sesame. Okay. But there's a bucket. I'm going to share with you my bucket theory, which I have in the book, which is like, let's say 0 to 10 is the bucket of allergic reaction. That's your histamine bucket. Histamines that, a certain amount is, let's say at 5 and above, we notice a reaction. But if it's 5 and below, we don't notice a reaction, even though we're reacting. But
Right.
5 and above, there's enough histamines to cause some itching, some rash, some diarrhea. Okay.
Yeah.
But let's say we give points to how triggering it is. And gluten, let's say a 4, broccoli is a 2, and sesame is a 3, let's say. They have different values to it.
Right.
But let's say you still react to all 3, but let's say this week, all you were exposed to was just gluten. You didn't have any broccoli or sesame. This week you ate gluten and you're fine. Does that mean you're not allergic to gluten or reacting to gluten? No. But next week you had broccoli 3 days ago that made you a level 2 already. And then you accidentally got exposed to gluten. Now you ate the gluten and now you are at a 7-pointer today. And today you reacted to gluten.
Yeah. Well, that definitely happens. I know that because I'll think that I can eat a little bit of gluten and be fine.
And you were fine last time, but this time
then it catches up with you.
Because scientifically, this bucket theory is true.
Right. I love it.
And you don't know what you don't know. So if you don't even know it's broccoli, sesame, and gluten, and you're going along, I'm on my special elimination diet where if I eliminated 70 foods, of which I'm still keeping as part of that diet, the broccoli and the sesame, but I'm gluten free.
Right.
I'm egg free. I'm dairy free. I'm, nut free and all this.
You can't eat anything. Yeah.
But then you're sitting here and you're eating, I made a broccoli stir fry. I'm a vegan. I made broccoli stir fry and I put sesame oil on it, like whatever. And, and I ate a ton of it. And then this week I'm reacting to it. Right. But then next week, it's like, I only had broccoli, but no sesame with it. And I didn't react to it. Like, and you're already on an elimination diet.
Right. Yeah.
Like,
and you don't
data.
understand. Yeah.
You really need data. And I think about it as a mad scientist. So I love being able to listen to all these aspects of the story, look at all the different pieces of data and be like, well, let's mad scientist this and let's get you to the right answer.
Let's figure it out.
Yeah. Boom.
I love it.
Right? So drmaggieyu.com. You can look me up on YouTube as well, my name, with any symptom. You can also go to myfoodmapping.com to learn more about food mapping. Be the generation breaker of this. Be the person that initiates the ripple effect. Start with yourself. Work with me on food mapping. That's a great start for anybody with any chronic health symptom, because I can tell you right now, I can tie every single chronic health symptom that people are experiencing, any sort of mystery medical diagnosis or lack of diagnosis. I will tell you that digestion is a minimum 20% of the problem. And food allergies, minimum another 20 to 30% of the problem.
Like, well, and that makes all kinds of sense, right? It's all connected.
Right. And you need someone to address both and in the right order and with your data. That's what we do with food mapping.
I love it. Well, I appreciate you being here again so much. It was so much fun. You have so much energy that you can just talk a blue streak. I hardly have to say a word, and I love that. I love your energy, and I love what you talk about. And maybe at some point we'll do it again if people are out there and they want to learn more. Just
Yeah,
leave us
what
some
I would love,
comments.
let's do some fact finding, right? So
Yes.
everybody in the comment section right now,
Yeah.
if there's anything that I said, that Julie said that really sparked a question in you, put it in the
Yes.
comment section. She reads the comments, I read the comment section. I would love to be able to come back and serve in any way that I can, because I
Absolutely.
listed off 10 other topics that we didn't even get a
I
chance to talk.
know we have a whole list of topics that we were trying to, but I thought the digestion and the food allergy thing was
Poignant. It's poignant
sorry,
and
my
timely.
allergies are kicking in. I need to do it.
It's poignant and timely for Julie right now.
I know. I'm choking here on the podcast. So, but I appreciate you so much. And I thank everyone for listening today. But yeah, leave us the comments, leave us the questions, and hopefully we'll do it again.
Love it.
Have a beautiful week, everyone. Bye.
Bye.
Bye, Maggie.